Okay, so good evening, everyone, and thank you for joining another round of Heart Support Australia's Heart Support Connect. Our aim in this is to connect leading cardiologists, researchers in cardiovascular disease, and leaders in the field in Australia to our consumers, Australia-wide, and also clinicians in cardiovascular disease who support us in our causes across the country. Today, we have a leader in the field, a guru, I like to say, Professor Robyn Gallagher from the University of Sydney. She's a professor of nursing and Faculty of Medicine and Health and Sydney Nursing School based at the Charles Perkins Centre and an honorary professor at the Edinburgh Napier University. I'll give a brief intro, if you don't mind, Robyn, but Professor Gallagher's clinical and academic career focused on understanding and supporting patients who have cardiovascular disease, engage in secondary prevention behaviours to reduce their risk of future cardiovascular events. She has been a leader in cardiac rehabilitation internationally and in Australia, and we are thankful not only to have her here tonight, but she's also a patron of Heart Support Australia. So welcome, Professor Gallagher, and thank you for presenting to us on this cool autumn night for all of us in Australia.
Yeah, thanks so much for the kind introduction, Christian. And it's always a pleasure to be talking directly to people who've been affected by heart disease. Tonight, I'm having a topic which is a little bit out there, a little bit different from what people would expect, but I think it has applications to all of us for talking about behaviour change. I was just saying to Christian, behind me, I'm chair of the International Council of Cardiovascular and Pulmonary Rehabilitation. So behind me, I have all of the countries around the world who are part of our organisation, of course, including Australia. And it's a reminder to everybody that sometimes when you feel alone or isolated managing your heart disease, that in fact there's organisations worldwide who are handling this. So I'm going to start sharing my screen. It may just, you have to allow me.
I'll give you access.
To host. Yeah, if you let me host.
Does that work now?
That's right. It is working now. And what I'll do is I'll get my screen up so that I can work out the share. So, Christian, when you are looking at this, you're seeing my full screen slide?
Correct.
Great, thank you. So tonight we're talking about serious gaming for heart health. And I'll talk a little bit about the challenges people face in making lifestyle changes, including myself, how game strategies help, and what the research says and what people think about it. Chasing down my screens. I have 3 screens active, and sometimes I think I just shouldn't do that. Did that just go blank?
Yes.
That's pretty weird. I'll just stop sharing for a moment to make sure I get this right. And apologies, everybody. Okay. Oh, I see what's happened. Going right to the end automatically. Goodness me. Okay. So when you look at this slide, I wonder what comes to your mind. For me, what comes to mind immediately is the game scissors, paper, rock. And I presume most of you have played this game as a kid, or you've played it with your children, or you've seen other people play. This game is one of the ones that I think of as most international. In all the countries I've visited, I see people playing scissors, paper, rock. But why do they do it? Why do people play games? We're going to come back to that now, a bit later on. First of all, though, we need to think about secondary prevention of heart attack because it actually requires a lot of behavior change. So when you sit there and where you listen to us, people from cardiac rehab, cardiologists, nurses, exercise, physiotherapists, we give you a list of things. Take your medication, have medical checks, manage diabetes if you've got it, don't smoke, do 30 minutes of moderate vigorous activity 5 days a week, have some healthy eating, control your waist, the fat around your stomach, manage depression and respond to symptoms. Now, I think when you look at that long list, you can see why sometimes it's really tough, or at the minimum, it's certainly not fun. But when you look here at cardiac rehabilitation and what people are doing, this is a really important part. And in this particular slide, you can see people engaging in physical activity. Enough physical activity that will actually change your risk of having another heart attack. But there's one problem with going to programs like this, which are cardiac rehabilitation, and this is the problem. If you look at this graph, along the bottom, you can see the years 2005 to 2015. And on the left-hand side, you can see participation in cardiac rehab. But that little line that goes along the bottom, 34%, 33, 39, 37, you can see that in over a decade, and many more actually, participation in cardiac rehab has never gone beyond 30 to 39%. Cardiac rehabilitation, even though it's effective and useful, has persistently low uptake. So what's the problem, given that cardiac rehab can help us with all of those secondary prevention behaviours? The problem seems to be inflexible models of delivery. Cardiac rehab is usually delivered at fixed locations and times, twice a week, 12 to 1 p.m, or in group-based models where you all gather together and exercise or have education. And the amount of programs offered are limited by staffing and equipment available. So that's a problem. So for people in my group at Charles Perkins Centre, which is a centre for innovation, we're encouraged to think about, what if we could do something else? What if there is a different idea that would help people manage lifestyle change, exercise, and do things different? What could we do? So for our group, we started looking at this. If you look at the photos that you see, what you can see are people engaged in doing something they enjoy. They might be playing mahjong, they might be playing in the yard, they might be playing bingo or pool or tennis. But we as human beings have an innate human desire to play, to connect with people, to take on challenges, make progress, and win. We want to do these things. Nobody actually makes us to do it. So that's to play, to connect with people, to have challenges, make progress, and compete. We asked ourselves, what if we could use games to help people improve their lifestyle? So when we talk about games, for those of you who play games, for those of you who don't, for those of you who see children and adults playing games on their phones, the game mechanics that are used are badges, which are rewards. There's levels, meaning that people get tested at more advanced levels every time, so they have a challenge. There are leaderboards where you can see how other people are going, so you have a sense of competition. You have a progress bar so that you can see how well you're managing. Sometimes there's virtual currency, and sometimes there's awards, and sometimes there's challenges between users. So when we think about game concepts for heart patients, well, sometimes we think to ourselves, will that work? Will using a digital game actually work? On the right-hand side, you can see that this is the internet and smartphone use worldwide. And you can see in Australia, we're right up there. 93% of Australians use a smartphone of some type. And that means that you have access to web-based, internet-based devices that can assist you. So when we did our research a few years ago now, we worked out that in cardiac patients who tend to be over the age of, over the age of 55 or 65, we found that 88% owned a smartphone and have internet access, and 52% were using health apps already. So our point of view is, why not use health apps? And if people are already using, why not provide a health app that is by credible people and worked out for Australians with heart problems specifically? So when we brainstormed, what if we could, we then reviewed and had a look at the available mobile apps that looked like they had some promise and could be cost effective in this population of people with heart disease. We came across several studies that tested out game apps. On the left-hand side, you can see the things that really worked in these apps were goal setting. So having a goal. So your goal might be to reduce weight. Your goal might be to exercise more. Ones that had challenges that were set by the app designers that showed progress or tracking and had a virtual health or a kind of image. So I'll go through those, what I mean with those. So by goal setting, you might have a goal that I'm going to walk every day this week. So my app is going to check in with me every day and see that I've done that. It's going to send me a little bleep that says, did you walk today? I might use a challenge. So my challenge I might set is a weekly challenge. So I'm going to add a hill on Saturday. So on Saturday, the app sends you a little bing and says, did you climb the hill today? How did you go? It might be that it includes a tracker. And the tracker might be one that you wear on your wrist, like a watch. It might be part of your phone. It might be a step counter. Or it might be that you use a phone diary and just simply write things in. Or it might be that you have a piece of paper on your fridge. But that's what tracking means. And we know tracking works. And what they mean by virtual health progress, it can show a step on a path towards health, a leaf on a tree, adding a leaf every day, but the image is of health improving, and it can be very rewarding. We then ask people like yourself, what do you want in an app? And one of the things people said is you want credible disease and treatment information. That is, the information comes from groups we can trust, from cardiologists, from well-known nurses and well-known prevention people. It's personalized, meaning that it suits you. When you come on the app and it says, hi, Christian, how are you today? Or I noticed that you have set a goal for such and such, and this is my suggestion. Being simple and having how-tos for the initial use so that when you use an app, things pop out so that you can work around the app. Self-tracking and preferably synchronizing the activity with devices that you have. So if you have an activity tracker on your wrist, that you can sync it so you don't have to put the data in yourself. People want it to be user-friendly and interesting and have rewards that matter and a community of other people like themselves. But particularly they wanted prompts So things, messages that encourages people to take up challenges and to take up things that were valuable, or perhaps provide reminders to take medications that, if that is your goal. We then went to work, and believe me, working with an expert panel was easy. Working with software designers, not so easy, because most of them were aged between 21 and 24. And there were very interesting conversations about whether we carry our mobile phone with us all the time and how we use it, whether we've got prompts turned on or off. So a lot of work went into making sure that an app would be useful and it would be appropriate for us. So goodness me, look at this long list. So behind this long list are all the things that we took into account when we built an app that had game features. The other thing we included were lots of content experts, and some of you might have come across these people, most of whom work as cardiologists, leaders of nursing, leading researchers in New South Wales. So this is what we developed. We developed an app where the main story was about a heart. We used tracking overall for fun and achievement. People could earn points and rewards, and what you see on that illustration are coins. And there were challenges set every day that you could choose yourself. There was a story platform so that when people tuned in, much the same as when you tune into a TV show, that you're tuning into a story. And the story in this situation is representing your heart. And in this case, this little heart, eyes are a little bit red, and the background's looking a bit dull. So you know that something needs to be done to help this heart get a little bit better. So what we would do is select a challenge, and the challenge might be to walk 20 minutes today. Simple as that. And you would earn coins. And the heart would look more relaxed because you use the coins to feed the heart, exercise the heart. So that's what a game story platform means. We added fun things, like in this case, it's chasing the cholesterol off because the person would use coins to buy the drug. Take a blood pressure, exercise on the bike. Lots and lots of challenges were available that suited your stage. So or your particular circumstances. So if you were a person who had high blood pressure, then you would choose a blood pressure challenge. We tracked, and so the game synced with any device that you had, but we provided Fitbits because they were pretty easy to use, and patients seemed to like them. But one of the central features of using an app is to provide something interesting to do so that you feel like going back to the app. So in this case, we developed a block mover. So all that junk food could be moved around until the red blood cell could find its way through the artery and get out. The way it worked is you would log in, you would choose to do a mission, track your health, play a game, and from those things you earn coins and care for the heart. And you look at how other people are doing and you think to yourself, do I want to compete? Importantly, whenever you develop something, no matter how way out there it is, like a game app, you must test if it works. And you must understand if it works or doesn't work, why and how that happened. So in our game, we were able to look at the way people use the game. We were able to see whether people were tracking their blood pressure, for instance, whether they selected missions, whether they earned coins, whether they were doing the quizzes. And we had focus groups where we spoke to people and said, what did you think about it? And tell us the truth. we also ask them, is there anything horrible or annoying about it? And it's really important that we got honest opinions. So people like myself couldn't do the focus group. We had to get other people. And sometimes we would use patients who had recovered. So when we looked at our results, this is what we found. Most users entered baseline data, and about a quarter did 30 days of tracking. And our research shows you have to do about 30 days to track for it to be successfully helping you. Most people were looking at their weight, blood pressure, and exercise. And some people also looked at whether they'd taken their medication. We then looked at how people use the app. So here's the thing you learn about software and games, is whatever thing comes up first, which was healthy eating, is the thing people will most look at. Whatever comes up last, people won't scroll to, and that was diabetes. The other thing we learned is, for instance, there was a word scramble game. Some people will play the games a lot. I mean, a lot. And they love the challenge and they find it interesting. So what we looked at when we looked at this game, the missions that people took on were mostly eating or activity related. And that's because they happen every day. Whereas things related to your cholesterol might be less frequent, or your blood tests. We also worked out that the people in our study, and there were 390 people, were either game players or they weren't. And that is probably true of life, that some people play games and some people don't. So I'm going to take you back now to the beginning. We know that game principles can be used in any setting. We may choose to use them in an app, but they can be used in any way in your normal life. And games don't mean running around a football field. They can mean doing a crossword. It can be playing Scrabble. It can be trying to be faster than someone else in your car. In cardiac rehab, the interesting thing is games are happening anyway, game features. For instance, this man is tracking his progress. He's looking very carefully at what his exercise is doing. He is tracking to see, not just am I going to do the 10 minutes so I can get off here, but how fast have I gone and how far have I gone? This man over here is taking on a challenge. You can see he's decided he is going to reach as far overhead as he possibly can. And that's an innate thing we all try to do to improve. Whereas this man is basically competing with the others in the room. His eyes are completely focused on the two other guys in the corner. And he's thinking, well, can I keep up with them? Can I compete with them? Can I do better? And most of us do that. It's just a natural tendency. And for this man enjoys exercise. And that's the play component, just the feeling of moving and thinking to yourself, I really enjoy that movement. So when we go back to this game, scissors, paper, rock, I encourage you to have a go at it try it out with someone tonight, because scissors, paper, rock is used almost in every country worldwide. And not only that, scissors, paper, rock are an indication of what? Our innate desire to do things, and we try to capitalize on that. So worldwide, the people I work with have also developed games that use a motion sensor like Wii Fit. So you stand in front of a TV screen with the motion sensor, play bowls, exercise freely, move your arms. when you walk with the Heart Foundation Heart Support Walks, there is naturally a game element to that because you will naturally try to get better every week. And sometimes you might want to keep up with others or advance beyond others. So basically, over to you again, Christian. So this is all about gains for heart health. I'm not sure if you're on mute, and oh, I'm sorry, can you make me host? And you are also on mute from my kind of position. Okay. Okay, so you're host now.
Great, thank you. Sorry, I couldn't unmute myself because of the hosting situation. But look, on behalf of Heart Support Australia, as one of our patrons, thank you so much for that really insightful talk that I think is actually easy for consumers to grasp. I do have a couple of questions myself personally, and a couple that have filtered through from people who are watching. I guess one of the things from, I guess, a personal perspective and as a fellow researcher, what, we see some of the interesting research that you highlighted, how when you showed the table, what was really important for people across the studies, and goal setting was really important, whereas, these new apps that are coming out, talking about prizes and rewards kind of, say that they are better at engaging people, where it actually seems the goals are really important. What's the clinical translation into this? And as researchers, as academics, we come up with all this really cool stuff. We research it. Is this something that's going to be implemented in the near future? Is this something that we can see in cardiac rehab programs? Is it going to take some time?
Well, Christian, so number one, because I'm a really honest person, I can honestly say to you that some people don't like the heart game. It actually offends them because they think their illness is serious, and it is. And so to see the heart character, it offends. Whereas for other people, they think it's fun. So one of the important things about apps is they've got to be able to be tailored, to be individualized, and they've got to be right for the group you're talking to. So people who like to have fun, who like to play games on their phone, then the My Heartmate app is perfect for them. For other people, the Apple Watch or the Apple phone health app is better. It's serious, it's tracking, it's getting on with things. But one thing I would also say about most apps is that you tire of them and you don't need them after a certain time. You don't necessarily, when you're first unwell or you're thinking to yourself, gee, I've slipped and I'm starting to not exercise again, that's the good time to have certain apps that include games because it will motivate you. As a general rule, 3 months after you start an app, you're probably not going to use it so much anymore. And that's okay. You can change. It might be you just need goals and monitoring because you've worked out a lot of other things by then. So the implications for me is that there's an app that will suit everybody. And we as health professionals have to help people find an app that will suit them.
I think, and that is a fantastic point, because I think as a former clinician myself, even being a part of a lot of discussions around technology apps to support, I think one of the issues that we do is that we always try and find this one-stop app that we say in our program, we're going to use this app. But the reality is that maybe in actual fact, what you say is that we should have 2 or 3 apps that are suited for different types of personalities, and then cater that accordingly to the individual characteristics. So that's a really important thing. I have a message here that came through. It's like a text message from somebody. They're saying, I'm older, and looking for motivation. And ultimately, these apps, can they be accessed without needing to go through a program, or without having need to be a subscription? Can they go
Yes.
directly?
So, Christian, I'm going to answer a little bit of yours and a little bit of this person's
Yep.
request.
Yep.
First of all, I think we need a toolkit. I think we need 5 different apps, and one of those apps should just be a tracker where you can just say, this is how you can check how much you're exercising, for instance, and you can set a goal and follow it. A tracker, a pedometer. In terms of this person's request, the My Heartmate app is freely available on the App Store. You're welcome. If you want to use it, try it. Every single mobile smartphone that I know of actually has a health app in it. Every single one. So you could just try those. Just give it a go. But there are very simple apps, which is about behavior change. And one of those is called Strides. Strides as in stepping out. And you just set yourself a goal, and you ask to be notified every day to remind you, because reminding is really important. And you record what you've done. That is the simplest form I've ever seen. You do have to be careful with health apps that you're paying for. As we discovered, some of those health apps end up linking back to a lot of advertising, and you just do have to take a bit of care with that. Yep. But may I remind everyone that the game aspect of life is actually about finding the joy. So if you are feeling not motivated, you've got to find a way to find the joy every day in the things you have to do. And for me, it might be thinking, all right, I'm going to go outside and I'm going to go for a walk that makes me short of breath. And I'm going to count how many different birds I hear. And because I like that. So that's the joy. But a lot of people find the joy in doing things with other people who also really care about their heart disease.
Thank you. I got one question here. No, it does. I have a question here from a clinician. So their question is ultimately, is there an app that could be recommended that I could have input in from the back end and to see how my patients are tracking along? So
actually, no, there are none that I know of, because to get the people who develop the apps own the app. And some of the app makers do not want you to get into the back end. An example of that is most activity trackers have an algorithm built in that determines the way you're walking, whether it's moderate or vigorous or fast moving, or whether it's going up flights of stairs. And so they won't actually allow you to do that. I have a developer's license for Fitbit, so I know that particular thing. I'm also working with Southeastern Sydney Local Health District, where we have developed a cardiac app, and it's in testing at the moment. And so we pay to have access to the back end as clinicians.
Right.
There is it's not quite an app, but there are some commercially available ones like CardiHub.
Yeah, I was thinking that. I mean, is there ways that clinicians can, I guess for this person's question, is there ways that we subscribe that clinicians can have information somehow exported from their patients that they give that to, if I recall correctly?
Only if you pay for it. So they're commercially available. For instance, so CardiHub, if you're a clinician and your local health district, say, pays for it, or Medicare private pays for it, Medibank private, then you get connected with your patient through that.
Right.
But you can imagine somebody has to pay for the service, somebody pays for the software, somebody pays for the data custodianship, the safety of the data, so that there's no breaches. So that's why it's got to be commercial.
Yep, no, totally understandable. Well, look, we're of time and we're when we started. I would like to say, unless you have any other words, thank you so much, Professor Robyn Gallagher, for being with us tonight on Heart Support Australia. We are recording this. We will put it online on our website, on our YouTube channel, and distribute it across our groups in the country, and for a lot of our cardiac rehab clinicians in regional areas who actually like to actually click on and see this. So I guess if they have any further questions down the track, they can reach out to Heart Support Australia, and perhaps we could even reach out to you. Or I think they even saw some details on the front page of
Yeah,
your presentation. I think
absolutely.
that
Very welcome. Very welcome. And you can see my email address. You're very welcome to keep in touch. And so I hope I've motivated you to think about game elements when you look after yourself, and finding that little spark that makes you want to do the things that, well, frankly, you have to do. Just makes a
it's
big difference.
it is very true. And look, it's not an easy pathway. We are talking about lifestyle modification.
Yeah,
But everything counts, everything helps towards getting patients to having a healthier heart and, of course, a healthier life, because that's what we want to do at the end of the day. So, thank you so much again. Wishing you
it's
a
a
good
pleasure.
night. And thank you
Thank you.
for your support of Heart Support Australia. And we'll speak to you soon.
Thank you.
Take care.